Here's some more tips as far as for your claims management. Diagnostically, it is already a challenge as people get older because of this concurrent conditions that may be involved. So make sure that we have the appropriate specialists and make sure that we have the doctor recognize to how to address these incidental findings. Okay, because there's a lot of times because of the aging or maybe their recreational activities or medications, the lifestyles, and the support system, like the example I used earlier, that may contribute to some of these challenges. So it is important, and oftentimes we see the doctor put in the report of all these kind of findings, and then, they don't separate that. And we have to go back and ask the doctor, wait a minute, how is this condition relate to the injury? Is this something totally unrelated to the work injury and it's just happened to be an incidental finding? We have to make sure we separate that. Okay. Identify those comorbidities, right? And especially like medications. What are they taking? Are there some conditions that may impact on recovery? Are they taking the opioid concerns? Is it because they have other comorbidities that they're using opioids for chronic pain? And so we have to be very careful that we are not over prescribing as well or duplicating some of these medications that they're already taking because of the danger of therapeutic duplications. That is what it is, the danger of medications, the same type of classification of medication that is being prescribed. So we have to always understand what medication they're taking for their general other health conditions and how that may impact on the work injuries. So obtaining a very good thorough history will be very helpful. And identify, prevent secondary injuries. And so you need to identify what are some of the risk factors. Do they have trouble sleeping? Do they have musculoskeletal problems? Or do they have confusions or maybe behavioral problems? Because, things like that, if we recognize these risk factor early, that is going to help them as far as the recovery or how we may be able to provide them assistance outside of workers' comp, okay? Because these conditions do impact on their recovery and return to work as well. Same thing with patient or claimant and family education. A lot of times, family think they're doing a good thing for them, but sometimes if they don't understand, what is a safe thing to do, what is not, it could do more harm than good. So that's another way of preventing a lot of education so that they understand the injury, they understand, their course of treatment and the importance of